Hi, so for this week's video discussion, I've decided to pick Horner syndrome and Marfan syndrome for the two issues that I will be going over for specific eye conditions that were discussed in the chapters for this week. So for Horner's, if ptosis, meiosis, and anhidrosis are all present, it is usually quite indicative of Horner syndrome. And another factor that indicates the presence of Horner syndrome is if the sympathetic fibers that normally dilate the pupils are defected, then that is also a very common cause of Horner syndrome. And Horner syndrome is often caused by events such as intense great physical trauma, also a condition of resulting from lung lesions, and also if it is congenital Horner syndrome, heterochromia is extremely indicative of the congenital version of Horner syndrome. And as you can see here, here is a short, small visual of a patient who is suffering from Horner syndrome, as one of the extremely telling signs of Horner syndrome is that the pupil does not dilate even in the presence of direct light, which is exhibited by this little flashlight here. And moving on to Marfan syndrome, so some of the factors that are indicating the presence of Marfan syndrome are the dislocation of crystalline lenses, heart problems, musculoskeletal issues, and a family history of Marfan syndrome. And another very common factor and physical sign of Marfan syndrome is if the zonules that are normally attached to the crystalline lens are absent, then that is extremely indicative of Marfan syndrome. This in turn will then cause a distorted refractive error and ultimately leading to aphakic refractive errors when the crystalline lens becomes completely dislocated from the visual axis. And as for treating Marfan syndrome, lens extraction and an intraocular lens replacement can help fix this issue. However, increased intraocular pressure can be a possible complication after such a procedure. And here's a visual just showing when there is the absence of zonules from the crystalline lens, which, as you can see in this visual, can therefore is indicated by the lens, the crystalline lens, becoming very abnormally dislocated from its normal position, where it would be more like in the center of in between the iris if the zonules were properly attached to it. So yeah, you can see here that it's very out of place. And last of all, these are my sources that I've gotten my information from. And yeah, thank you for listening to my video for this week's video discussion.